Sessions now. Mr. Mohammad Rasheed Al-Amasi, as the Managing Director of UAE, American Accreditation Commission International, will be talking about the role of accreditors in patient centricity. Mr. Mohammad, the floor is yours.
I have no idea how to follow up after that. Can I? All right. All right. Good. Oh, that's fine. Right. This gives me some memories. Such a great audience. Last time I spoke in front of such a big audience was when I was in college. It was a little bit bigger audience, but it was all in front of my professors and colleagues. I was doing a stand-up comedy that was almost got me expelled, so I hope this one is gonna be better. Now, I studied medical physics, and for those who don't know what medical physics is, it's just like the physics of radiology, radiotherapy, and nuclear medicine. Only the physics part. So I have been working in quality and healthcare for the last 10 years, so that makes me the least experienced of you all guys. Now, after this presentation and after Dr. Sam Al-Ham presentation, it is really very difficult to follow up. I'm going to try to be as enthusiastic as Dr. Al-Ham was. Yeah. And yes, first thing, we need to always appreciate healthcare in Abu Dhabi. It's not only emergency services that are being covered for free here, it's also some other critical care like cardiac and kidney diseases all being covered for free. I mean, this is really amazing. So, hello everyone, my name is Mohammad Rasheed, and I will begin by telling you a story. 7 years ago, I went to a hospital with my wife. She had pain in her wrist, okay? And we went then to the reception. It was a very nice reception. They had music going on and everything. It was a very nice, cozy environment. And I remembered I forgot something in my car. So, is this, okay. All right, okay, so you go back from here? All right. So I went to my car very quick to grab something. I was out for less than 5 minutes. I came back to the hospital, to the reception area. I was looking for my wife and I couldn't find her. I gave her a call and she did not pick up, so I started asking. Next thing I found is that she was having an ultrasound. I don't know what happened, but she was laying down in the bed and getting an ultrasound. Wrist pain, 5 minutes, ultrasound. So that was the first time we've encountered my 7-year-old son, Rasheed. It was a very happy moment, and we forgot all about her carpal tunnel issue. But since that day, every time I go to that hospital, I make sure that I grab everything from my car before we went to the hospital, not to forget anything there. And it's not only that, but it also made me very skeptical about every doctor's order since that time. Now, okay, so here we're going to talk a little bit about patient-centric care. I think this slide is very familiar with everyone knows what that is. So let me just tell you one thing. Do you think that experience in that hospital was patient-centered? Have you never heard about patients saying that they are like being treated as money collection machines, that they only go to hospital when they have to, when they are in so much pain, which I think is very, very risky? Now, what is patient-centered care? What I want to argue about is that it is not that sophisticated. And It does not require hospitals to do huge investments and huge amount of money spent in changing different processes and procedures. And I want to ask a question to the audience, if anyone can answer me. Can you tell me what we can take out from this graph here? It's about life expectancy and health expenditure. Can anyone give me one takeout from this image here? Again? I'm sorry. No, it's not about the red line. It's not about only the red line. No. So, anyone? Yes?
It's not how much you're paying for it.
Exactly. Exactly. The takeout is, it's not about the money. It's not about how much you spend. So, money is not a factor here. Okay. So, I would argue that it's the little things. It is the little things that need to be taken care by the big people and organizations. As per Dr. Roll's discussions yesterday, he said that we are living in an era that is specialization into specialization, and that it's getting deeper and deeper, and we have to always take a step back and look at the bigger picture. Okay, so when I was preparing for this presentation, the organizers here did not give me so much time. It was only 6 months, come on. And I think I had to have more time to go back to medical school to be able to address this audience. So when I was preparing this, of course, I went to Google, and the one thing that I found that is repeating in every page was this statement: start with patient first. So what I will be doing today, I will be discussing patient centricity from a patient's perspective, and from when I say patient perspective, that patient is going to be me. All right. First of all, patients can choose their treatment. We need to focus on the transition between doctor-centric, or should I say insurance-centric care, to patient-centric care. And you just need to listen. And from my experience, I went to one hospital the other day. I told them I had a problem in my knee. I'm a diabetic patient. I need to do some checkups. And I had to see the urologist. So the one in the counter told me that there is one very nice doctor. She will fix all these problems for you. You just need to go and see her. So I went down and I saw the doctor, and I was explaining to her all the problems. But when I went to the doctor's room, she was an endocrinologist. So some information I have about endocrinologists is she's not gonna fix my urology issue. So I told her that I wanted to see a urologist. And after she ordered some tests for me, I went to the lab and I've done them, and I came back after 1 week. So I went back to her office, and she was looking at my test results. She said, okay, you're good here, no problem here, no problem, you're fine, you have nothing to worry about. Oh, wait, you have blood in your sample. You have to go and see the urologist now, it's very urgent. So, didn't I tell you that I wanted to see a urologist 7 days before? Like, we just have to learn to listen. It's all about the little things. Now, the other thing that I want to talk about is respecting time and culture. No one wants to wait for 1 hour or even 30 minutes. Everyone is busy now. And I want to ask a question. Do you remember the last time you went for a doctor's appointment and actually went there immediately without any waiting? I don't think that happens a lot. So after she referred me to the urologist, I went to the urology clinic on my appointment time. and I had to wait for another 30 minutes. And they told me that after all that happened, I discovered that I was waiting for an interpreter. The nurse somehow thought that I don't speak English, and she thought that it would be a good idea to bring an interpreter to the room so that the doctor can communicate with me. So I went into the doctor's room, and I found a very beautiful lady interpreter sitting in the urology clinic. And why do I would want to have a female interpreter in the urology clinic? I wouldn't want a female interpreter even if I didn't know to communicate with the doctor. So look how many things have gone wrong with this one. It's all about the little things, guys. Okay, so now, also, one little thing that can happen is to make it easy for patients. I'm gonna share a rather cheerful experience, something positive here. In one of the hospitals, when you go to the emergency room, when they discharge you, they will give you their medicine with you. Like they will give you the medicine and they will tell you how to use it and leave. So basically, they will not just give you the prescription and ask you to go and wait in the pharmacy, which is very good to see. I mean, at least you know now you don't have to spend another half an hour or 1 hour or even more just to dispense the medicine. Now, I don't think they take consent to do so. Maybe they give you a bunch of paper to sign. Yesterday, Dr. Aliga said the patient will always sign the papers that you give. So that was a good integration. I mean, they have done it for another reason, but it's a good integration of services that can make our life easy as patients. So again, it's the little things. I don't know what Salim is doing here. This is Salim. He's my son. And I'm going to tell you a little story about Salim. Okay. So, when Salim was born, he had a coarctation of the aorta, right? And 7 days after 2 weeks actually after he was born, it was time for his operation. Now, I want to say this because I want everyone, doctors especially, to not underestimate their power. Doctors are very, very powerful. Now, it was time for his operation, and when we got this news, it was like a nightmare for us. I mean, it was so stressful for the whole period, for the whole 2 weeks. Now, after 2 weeks had passed, it was time for the operation. The doctor called me to give me the informed consent. And he saw that I was worried about my son. So what he told me is, he said something, I mean, during the informed consent, he said something. He said, sir, listen, I have been doing this for the last 30 years, and I am the least experienced of a multi-specialty team that will be taking care of your son. He will be fine. And that moment, it was a relief for me. It was the first time I felt relief for 2 weeks. I almost cried. So patients are people, and doctors are not money makers. They are being perceived as authorities. They are being perceived as people with confidence, with reference, with power to do changes and to make lives better.